Hello, and I welcome you all on behalf of Medical World for You India. Well, in today's video, we are going to discuss how an Indian dentist can practice dentistry in United States of America. So to understand this thing thoroughly, we have discussed the whole scenario with Dr. Pratik Gupta, who himself is a DDS from University of Southern California, USA. So let us understand what are the challenges, what are the real life situations you can face while preparing for that and when you are planning to actually settle and get a license to practice. So we will discuss each and every step in detail with Dr. Pratik Gupta. This video contains all the real situations. It has been explained precisely by Dr. Pratik Gupta. So do watch this full video because if you skip it, you can miss very important steps. So if you are seriously eyeing to practice in USA, this is the video for you. So stay tuned and watch the full video. I welcome you all on behalf of Medical World for You India. So, as we have promised you that we'll be coming up with a road to DDS for Indian dentists. So, we are privileged to have Dr. Pratik with us today. We are going to give you a practical scenario with Pratik. So, I welcome Pratik to Medical World for You India. How are you doing?
Thank you, sir. Thank you so much for inviting me, and I'm so glad that I have this opportunity to help as many students answer their questions, to help them understand the process so that they can approach things and they can make the decisions accordingly. Yeah.
As a student, I can see that you are very studious and you were planning and you have certain kind of things in your mind that you want to practice in US. How you started it and when you decided to go to US and what was your thought about that?
So I was really, first thing, like, I came to this country all by myself, and I was really anxious and nervous about it. But throughout the way, by some mistakes and mishaps, and able to figure out the process. And then I realized, like, examination is not the difficult part. After that, going through school and all the interviews and bench exam, that's kind of a little bit stressful portion of that process. But sooner or later, like, if you just stick to it and determined about finishing it, you will get into it. It's not impossible task. Anybody can do it in this world. Yeah.
So what are the steps you have taken to prepare for examination? Because you have to give NBD 1 and NBD 2. Before that, you have to prepare with your transcripts and your ECS evaluation and all. So this is a basic step. But how you prepare yourself? How you molded in the situation? Did you took some coaching or you prepared by yourself only?
So I prepared by myself, but I would say that as we have discussed earlier, like, I wanted to do PG back in India. So during third year, I started my preparation to crack all the Indian exams, AIMs and AIPG. And those exams helped me a lot to finish these exams on timely manner and in first attempt. So I did not take any coaching, but yeah, I communicated with a lot of students on online platforms like the student network or the Facebook. There's a lot of groups, NBD Part 1, NBD Part 2, or United States Dental Students. There's a group. So you discuss questions, you talk with them. There are some online information you're able to get to, like the Kaplan you were talking about. So those kind of information from here and there to achieve what I wanted to.
So what are the prerequisites of these examinations? How to start with that? Suppose suppose someone is a BDS student, he has just passed out. So how he should start? What are the first steps and what are the second step?
So the first steps you have to have a dent pin. It's a 6 or 7 digit unique ID that ADEA assigned to any student. So to create an ID, you should have first 4 years of your BDS transcripts. So your transcript, either you have to get it from a university or your school. So you submit that transcripts to ECE evaluation, and once so ECE evaluation, it basically does that. It's kind of standardized all the grading across the world comparable to United States, and they convert your scores into GPA, so grade point average, and it is out of 4. So based on that, once you get that, it means that okay, you have a BDS degree, you have a grading, and now you're eligible to participate in the examination. So that's the first step to get registered for National Board of Dental Examinations. You cannot give NBD Part 1 and NBD Part 2 in India. You have to be here in the United States. And just an update, this year in July 2020. So the American Dental Education Association, they're gonna change NBDE into INBDE. So it's like integrated National Board of Dental Examinations. So what they're trying to do, they're trying to combine part one and part two into one exam. So those who have given the part one, they have option to give part two till July 2022 to finish their part two. But those who haven't given an exam part one, they have to give INBDE. So yeah.
Okay, then after what do you call these transcripts and all, you go to US and give your exam.
Yes.
Suppose you have passed your exam, so how to look for the universities and what are the criteria to select the universities? Because there are a lot of things, because I think there is a high amount of fee which is required. So how you prepare for that, and what are your suggestions for the people who have passed the NBD examination?
So once you pass the examination, over here, all the dental schools worked under a centralized organization we call CAPID. Okay, so you go to the website, all the schools, I think most of the schools, they participate in the CAPID portal. So you submit your NBD Part 1, Part 2 reports, your TOEFL scores, and your letter of recommendations, your statement of purpose, and whatever schools are participating, you select those schools where you want to apply. And most of the time, like my thought process was, I want to go to schools where there's not a lot of seats, because I'm just like, the way I was thinking that if there's like 120 seats in international dental program, and also you have to consider that the regular DDS program to students over here, it's going to be more than 100. Most of the school have that 100 to 140 students. So if you look at one point of time, it's like international program have 100 seats and DDS have 120. It's like 220 students going for trying to graduate. And I feel like it might affect the clinical exposure. So I try to apply it where it's not a lot of seats. And look up, you have to do your research, the fees wise. The fees ranges from like almost like 80K per year up to 140K per year in dollars. So depends, and depending on how many schools you're applying, that's much you have to pay in that CAPID application portal. If you're applying to all of them, the prices would be a lot. You'll be paying, I think I applied to around 28 universities, and I think I paid around, not sure exactly, but it was around $3,000 for that application. Yeah.
Okay, fair enough. So is there any other thing which is required after passing your examination, NBD Part 1, Part 2? I mean, any other kind of examination, I mean, apart from these two examinations?
You have to have your TOEFL, and like I came here for the MPH, so I did apply, I did clear my GRE. Only the school where I graduate, they want that, but it's not like it's a hard requirement. If you have it, it's good. If you don't, it's okay. So my school wanted GRE and I had it, fortunately, so I submitted that as well. But NBDs and TOEFL, these are the three main exam they want. Yeah.
Okay, fair enough. So once you have selected your college and all, and you've got a good score and you have selected a particular college that you want to go in, so what are the things that you go through after that? How many year of studies are there, and what kind of curriculum is there? Is it compatible to the Indian students, or you find a lot of colleagues who are Indians or something? I just wanted to know about the environment of studies and all. Must be different from India.
So I'll give you there's a lot of information. So first, there is no scoring for NBD exams. It's just like pass and fail. So if you get more than 75% of marks, you pass. It does not matter. Nobody knows the marks, neither university nor the ADA, and not student. You cannot request that, you won't get it. So just pass and fail exams. So you don't, in a way, it's good. You just have to clear the exams, that's it. Then you apply to universities, and curriculum wise, so most of the schools, they are range from 24 to 36 months program, so 2 to 3 years program, and the fees would be on yearly basis, like how much per year. And another question, Indians, there are a lot of Indians over here. So the one thing I've noticed over here, like you have to compete, like, because all schools, they have to maintain this cultural diversity. So they have to accept students from all over the country. It does not mean that if you have a pool of applicants comprise of mostly Indians. They cannot take all the Indians. They have to take other nationalities as well. They have to maintain that. And just for an example, like when I went to for my interview for my school at USC, they invited 150 or 160 students for interview, and out of 150 or 60, 100 to 105 were Indians. And out of that, they selected 34 students. And out of 34, those who started curriculum, 21 were Indians. So we are majority and we get selected a lot. But along with that, rest of the out of 34, rest of them were from different nationality like Philippines, Korea, China, Japan, Nepal. So they're like different nationality will be in your batch. So for comparing curriculum Indian wise, like even if we are from India, the schools across the India, they function different. I know it's basic same, 4 years, first year basic and last year clinical, but still it differs, and that's the curriculum. But I feel like I had a best of two worlds. Like in India, you were there, like we get to do everything from the scratch. Like we made denture from the scratch. We take impression, custom tray, teeth setting, and we deliver denture. Over here, we send it to the lab. So you know how to send to the lab, and if something goes wrong, you know how to understand. So I feel like the curriculum was really helping, especially me being from India. I cannot compare to any other country because I didn't have that exposure. But I feel like you get to have best of two worlds to see dentistry in a ideal ethical way, and also if in an alternate way, if this thing does not work out, then we try to choose another way as well. So that helps a lot. But the education system is a lot different. Like will be like so basically it's going to be, if it is a 2-year program, we'll be looking at the first year would be first 2 semester. It's always on semester basis over here, and every semester will be 3 to 3.5 months. So the first 2 semesters will be based on preclinical plus little bit of clinical portion of it, and from 4th to 6th semester, all about clinical. You'll be finishing requirements. You'll be merged with the regular DDS program where you're trying to finish all the requirements.
I think I really feel one more question can come in here. I mean, you have told that 120 students gave the interview and only they selected around 39, 49 students. So once you passed your national boards, I mean, you pass your, because there is no scoring as you have told. So what are the probability that after an interview you get the seat? I mean, is there some ratio like that? Because after passing your national boards, there are chances that you might not get a college for study.
So I know we skipped one whole step, and so what happened exactly? Once you clear exams, so you clear the exams, clear the board, clear TOEFL, you have all your documentation ready. And documentation, it takes a lot of time because the application opens on 1st March of every year. So the portal I'm talking about, the website, ADA Capit, it opens its cycle. Suppose it opens for 2021, 1st March 2021. So you apply to get selected in 2022. Okay. So when you submit all the application, you submit your reports, you need statement of purpose, you need 3 letters of recommendation, if you have any work experience, volunteer experience, and I think a few more things, all the reports, and those things you submit, and it goes to all the universities you want to apply. Then after, you wait. What I've done, I went to all the universities I want to apply, and I go to the website to see what other supplemental documents they want. Some universities, they want, okay, can you send us your GRE report, or can you send us another TOEFL score report? And they would ask, can you send me a resume? Like, so you have to be prepared for that. If you send them in a timely manner, and some school, they work on first come first basis. Like if the deadline is like 4th April and you're waiting for 3rd April, you're late in that area. So you have to be on top of that game to be first come first basis. Like they get application soon, they call you interview. They're gonna call you for interview as soon as they can. So once the deadline, every school have a different deadline. Once it go over, you have to wait for interview calls and bench exams. So the interview calls, they're gonna give you at least a month or 2 month heads up. And if you do not hear anything, like be prepared for rejection. Like I'm telling you, I applied for 20 at school. I got 3 interviews and I got 4 interviews. So rest of them are rejection. So you have to prepare yourself for rejection, and try to learn wherever you get rejection from. Try to contact the administrative department, like how we can improve. Try to get a feedback, and that will help you to improve your application. And if you get an interview, you're fortunate enough. So interview, I got 4 interviews. So you go there. It'll be 2-day process. One day would be a one-on-one interview with a faculty or a group interview,
Okay.
and second day would be a bench exam in which they can ask from wax carving, restorative prep, class 2, class 4, crown prep, and some school they ask endo and RPD design as well. That are really rare, but 3 are the main important, like carving, restorative, and fixed pros. So they will ask you that, and based on your hand skill, interview, your profile, and then they decide should we give you seat to be a part of that school or not. So yeah.
So that means I understand that after your examination you passed, then you went for an interview and your bench exam. So that is the final step of selection to any dental college. Is
Yes,
that
that is yes.
okay? Fair enough. So we have a curriculum of around 2 years for your DDS. Then what after DDS? What are the career perspectives? I mean, how you plan for that? Is there any exam, further exam to get a license, or you directly practice, or you search for a job, or you go for your own clinic? So what about that after your
So
complete session?
after you finish your all your school requirements, you have to give a license exam. There are 3 or 4 license exams. It does not mean that you have to give. It depends on which state you planning to go. Okay, suppose I was in California and I wanted to go. I was planning to go Wisconsin, and just see. Okay, before you graduate, you try to start looking. When your last semester, I started looking job the beginning of my last semester so that I have something lined up, and I found a job. Everything is done before I graduate. So I know this state I'm going, and I need to give this license exam because state of Wisconsin accept this license exam, and your school is gonna conduct those exams on campus with all the students because everyone have to go somewhere to practice. So this license exam would be conducted by your school. It's just like way we did in India. When we went to all the streets and neighborhood find class 2 patient. It's just similar experience, but it'll be a little different. Yeah. And so you find class 2 patients and you find your perio patients similarly, but that exam, it just like make sure you're clinical competent enough to practice in real world. And that is it. Like that, I have given 2 license exam because first I went straight in Wisconsin and now I'm in North Carolina, so I have to give another exam for that to be here. But it does not mean that for every state you have to give separate exam. Now I have given 2 license exams, so though it covers almost all the states in the United States. So that's to get licensed. To get a job, like it depends what your goal is. I have friends who started working as an associate or working for someone else. There are friends who went for post graduation. They are doing residence in endo, OS, perio, and like to open up your own clinic over here. It's kind of tricky because we are on a visa situation, so you need to have a citizenship or green card to open up your own clinic. So that gets a little tricky. Some students do have. If you have that, there's always an option to open up a clinic. So it depends what you want, all the options, and there'll be like a lot of students graduate from your school or group or network will be able to help you out. There's a lot of seniors who graduated before me. They helped me out to crack the interviews for jobs and what to look for or what not to look for. So those things will always help you out, but it depends what exactly your goal is to practice. Yeah.
Okay, most of the thing I got, but you were saying that it takes long time. You gave your application. It takes a lot of time to. I mean, they go through it. I mean, go for exams. Then you have to go for your DDS. So it's a very long process. If I say 2 years for your DDS, then you're waiting for your application. It takes a lot of time. So how you support financially in that particular period? Because you might have gone on a student visa. I mean, a lot of students would go on that visa only. So how it's a very long process because it's not just a single day work. It takes 2 years or more than 3 years. I don't know what exactly the time is. So how you stabilize yourself in that particular long time period?
So I'll give you my story, and everyone approaches this situation totally different. Like I that's why I came here, applied for masters in public health. And my thought process was, okay, I got selected to this school. I was full-time student over here, and during this 2-year program, I'll apply to dental school. If it doesn't work out, I would work as an MPH, public health official, till I get into dental school. So, and in that way, you can support yourself financially. And one good thing, this country is a land of opportunities. Like I was working part-time jobs on campus. I can support myself financially, and that I saved money to apply for my application for dental exams. So, just to give you timeline, so I came here in January 2013. I started my program, and in February I got a job on campus. They were paying me decent enough, so I can save and also pay towards my tuition. And your tuition based on how much subjects you're taking. So like it's about credit system. Like to finish your program for MPH, you need 48 credits, and one subject is worth of 3. So total you have to do 16 subjects, and it's up to you. If you want to finish the 2-year program in 6 months, you can do that. You can take 24 credits in first semester and 24 credits in second semester. Your life will be hectic, but you can do it. People does that. So that's one good thing. If you think you can do it, you can. So, and your fees will be accordingly how many credits you have taken. So I've taken 9 credits every semester, so to pay decent. Yeah. So during the 2013, I gave him a part 1 in month of May 2013. Right after that, in June, I gave my TOEFL. My score wasn't good enough, so I gave it again in July. And then I appeared for my NBD Part 2 in month of November 2013. So during that whole time, I had my MPH exam as well. I did spring semester, summer, and fall, and I was preparing for NBDs. And also, I was working part time on campus. It wasn't fun, but it's a part of a struggle. Like it was life changing. Okay, you get to know, like, okay, it'll be fun. Like now we look back on it was life changing journey. And during that time, after finishing my part 2 in 2013 November, I started working collecting documents. You have to call your universities, get a letter of recommendation. You need to have your actual degree. Provisional degree won't work, so you have to have actual degrees, work experience. If you had back, you have to start collecting your documents. And then in 2014 March, I applied for all the dental schools. And the first interview I had, I think it was in June 2014. Then I went to Indiana in July, and I think in October, I went to USC. And so the Virginia and Indiana, they put me on wait list. They might be good candidates ahead of me. USC, they gave me, okay, we gave you seat. They told me in month of November. And after I said, and they give you option, you want to accept it, you can accept it. If you don't, you don't. I accepted, okay, I don't want to waste any more time. And then after that, in December, Colorado, they also gave me interview bench option, and that I denied it because I already accepted seat at USC. So yeah, if you look at the process, it took me 2 years. But in 2 years, I have an MPH degree. You develop so much contacts, network. You understand how this country works, and that helps you a lot. And so, still going back to the timeline. So I finished my program in April. Finished my MPH in April 2015, and I started on 1st of May. I started my DDS 2015. So there was no break between the program. I finished my program on Friday, and I drove to California and started my program Monday. So people say that, yeah, it was tough, but now you ask me, it was best. Like dentistry is really fulfilling over here. You will enjoy it. So it was worth it. I understand people refrain, okay, another 2 years of education, but it depends what you want. So yeah, 5 years in India, 2 years of DDS over here, 2 years of MPH. If you're 30 years old, yeah, 1/3 of your life is gone in education. But it depends what you want. People do PG, people do PhDs. If that's what you want, you can do it. Yeah.
You answered my question already. I was coming to that question only. That is it worth it? That what all
Yes.
you have gone through. I mean, you have already answered that particular question.
Yeah.
One more concern is that your visa status was as a student visa when you
Mm.
applied for your DDS. How the things changes? I mean, you have to reapply for your visa because always since you are planning to do DDS, that means you are going to settle in US. That
Mm.
must be the main aim of doing the DDS. So what about the visa status as a student, then as a practitioner, or as what? I mean, because you're saying that you directly wanted to go for green card or something like that. I mean,
Yeah.
you have not told it, but most of the people might be having that thing in their mind because if you're doing DDS and you're giving so much of time
Mm.
in that particular country, so your full motto is to stay there. So, what is the visa status? How the things goes there in this particular journey?
So my main goal wasn't like to begin with was never to stay here. Like I want to like to get education, okay, and then we see how things work out for me. We still haven't decided I'm gonna stay here for good because I enjoy dentistry over here. The one thing is, okay, I want to pay off my student loans right now. Once I pay it off, then I'll think about it. And one good thing I look out of it, like, okay, it's a American degree. It's gonna be valid anywhere I go in this on this planet. So one thing, I have experience, I have degree. So yeah. And going back to the visa situation, like when I got my visa, it's for 5 years. They usually give for 5 years visa. My pitch for 2 years and my DDS was for 2 years. And then, as I told you, like when it was my last semester, I started contacting people for the jobs because they have to apply for a job visa for you so that you can work for them. And you have to be on top of that timeline so that you don't have any lapse between student visa and job visa. And actually, the actual terminology, student visa we call F1 visa and job we call H1B visa. So you do not want to have a gap. Most of the schools, actually, according to United States of government, they provide you a 1 year uh, provisional time we call OPT. So after you finish your DDS program, you have 1 year till you get your job visa. You have that 1 year time regardless. So that's the kind of like a grace period you get to get a job visa. Sometimes it does get a little bit tricky to find an employer who can sponsor you, but you will find it. You'll find it eventually. Like I haven't found anyone who couldn't find an employer who wouldn't sponsor you. So it's gonna be little bit challenging, but you can get it done. Yeah.
So last thing, I just wanted to know about the student loans. I mean, if somebody want to go for loans, because the monetary situation is there. You talk about 80,000 US dollars. That's a huge amount of money in
Yes.
INR. So any kind of loan facilities are there so that we can apply for that particular thing and support our studies. Because initially, when you're doing DDS, things would be tough because you are settling in states and going for studies. I mean,
Hmm.
suddenly you cannot get a job immediately. So any kind of loan facilities are there? It is there in India or in US. How to go for that for the young dentist who's eyeing for DDS?
So I'll be like crystal clear about it. Like, okay, so the only part that scared me from the beginning till I got into dental school was the loan. Because for student loans, like, okay, the $80,000 or $120,000, it's, if you convert in Indian rupees, it's a lot, and it's nobody have that kind of cash lying around to pay. And so uh, someone helped me out. Okay, they signed a loan. So being on visa, we cannot take loan by ourselves. We need someone to be a co-signer or a guarantor, in other terminology, to help us to get a loan from our United States banks. So they signed up for you, and it's the person who helped me out. Like, I'm here because of him. If he wouldn't, I almost at the verge of dropping the plan for another year. So it's really stressful to find, but my dad had some friends before I came to United States that this will be the process and will want some, and some people like already committed to me and promised me, okay, they will help me. So that kind of helped me a lot to move through the process. And some people will decide, okay, they cannot help me out, or whatever they help out, it's going to be huge benefit. And you don't have to pay for like 2 years right out. You have to pay 1 year at a time, and the bank will disperse money one semester at a time. So if you're able to manage for the one semester, that'll be good enough for you. So it's not like that you have to pay 80,000 right away. It's going like $15,000 to $20,000 per semester. So yeah, so you have to find someone who can co-sign your loan for you, and then once you graduate, you will able to find job for sure. That I tell you, that if you're looking hard enough, you'll find a job for sure. Like I did not have in this last 7 years in this country. I think more than that. 7 years in this country, I haven't found anyone that I did my DDS and I cannot find a job. Everyone find a job. Yeah. So, and you make a decent amount of money to pay off loan. So it takes time, how you want to live your life, it depends. But yeah.
It's really glad to know that all your hardship pays well and you're very happy there. And I hope the audience who's watching this particular thing, they also get motivated and they also prepare themselves at what are the things they'll go through in States and how to plan the situation. I mean, I think it's like more than 30 minutes that we have been talking. So it was a nice talking to, and I want to tell you that I want to promise my audience also that you will be again coming us if more queries are there. So we'll be definitely contacting you, and because I know that people will have a lot of questions. So thank you so much, Pratik. Anything you want to summarize to the young dentist who are anything I might have missed? Anything you want to compile with?
No, actually, yeah, the series of question you had was really throughout the process and was really good in timeline wise. So I think most of the common question people have about the process and time and the loan, and you addressed that question, and I'm glad I'm able to answer this question. Only thing, like, I feel like at this point of time, like, I'm just wanna put it on the board that I'm not extraordinary individual or student. I feel like if I can do it, any person can do it. And I've seen like so many students from different countries, and try not to think like, okay, am I too young for this or am I too old for this? I had a batchmate who was merely 23 years, who just finished internship in India, and he was here without any work experience, anything. He was my batchmate. I had my junior who was a dean of my batchmate back in Armenia, and who was 55 years old. So do not dishearten yourself by age or experience. Those guys can do it, you can do it. I know sometimes it's really difficult to get all the information back when you're sitting in India or in your country. It's difficult to get all the information when you want to go to the United States. Reach out. There's so many people out there. You can reach out to me. Feel free to contact me. You can email me. I can share email information, or you can always reach me out on Instagram. I'm much more active on Instagram. I'll answer the questions over there. And I think that would be it. Always feel free to contact me if you have any questions.
You have gone through the whole journey. I mean, because it's a hands-on experience, I might say, that the journey you have told about, because sometimes we apply, the things are not there, information is not there. I'm sure that definitely our viewers will be having a lot of gains from this particular discussion. And thank you so much, Pratik, for joining us. And I hope we'll be contacting soon.
Thank you, sir.